Please welcome Dr. Pawan Kr Singh, Head Haemato Oncology and Bone Marrow Transplant at Haemato Oncology at Artemis Hospital. Thank you so much, Mr. Singh, for joining us today. And it's a pleasure to have you with us. Now, we are discussing anemia in our country. And usually when you think of anemia, you think of only women and largely pregnant women. How prevalent is this? The data shows that more than half the population has anemia. Is this true?
Yeah, first of all, I would like to thank you and thank you, Anisha and Shilpa Medicare for inviting me for this usually informative and important, pertinent topic, anemia, which is the question which you have asked is about the prevalence of anemia. So, if we go by the WHO data, so yes, definitely, sorry. So, yes, definitely. The prevalence, what you have mentioned, is around 50% of non-pregnant women and in children as well. So anemia is a problem. First thing I want to mention: anemia by itself is not a disease; it's a manifestation of disease. And the most important cause of anemia is the nutritional deficiency. And in nutritional deficiency, the three important factors which are responsible for the production of hemoglobin are most important one is the iron, then other two are vitamins, that is vitamin B12 and folate. So these are the three important factors which deficiency of them can lead to nutritional anemia. And as per WHO data, in resource poor countries the prevalence is quite common. Almost 50 to 60% of children and pregnant women and non-pregnant women, they suffer from this disease, that is anemia. So government is also from government side also, and from WHO, supplements are provided and awareness is there, but still we see this much number.
Right. Uh, Dr. Singh, the statistics say half our population has anemia, which is largely, and a large proportion of that is women and children. But half our population doesn't live under the poverty line. Half our population doesn't have access to food. So is that what
Yeah.
explains such a
So
large proportion of our
yeah,
population is anemic, but they do have a regular diet, right? What's
I'll
the disconnect?
I will come to that. So if we see the WHO definition of anemia, it is less than 12 gram. So yes, the data is correct. The data says that half of population is anemic. So which means if you check the whole population hemoglobin, so they will not fit into, but sometimes it comes as 11, 11.5. And even with very low hemoglobin, because in nutritional deficiency, the hemoglobin falls gradually, and that does not cause symptoms. Sometimes even if the hemoglobin is 7 8 grams, people don't feel symptoms. Only thing is that sometimes they feel most common symptom is weakness, especially on and effort intolerance, weakness on doing heavy work. So, and if you have sedentary life, you're sitting at home doing household works, you may not feel symptoms of anemia. So that is why, but by definition, yes, if you see, if it is less than 12, that much is the number. So that is correct data. But
So,
yes,
Dr. Singh, when is it problematic? When is
yeah.
anemia
So
problematic? When it is below a threshold where it doesn't affect me, or
hmm,
when it reaches a stage where I get too tired every day? When is it a
it
problem?
the symptoms of anemia comes when the hemoglobin falls rapidly. Suppose if anybody's hemoglobin falls from 12 to 7 in just 1 or 2 days, that can happen in case of bleeding. Suppose if anybody, that's what happens with the, and people, patient can die also. That happens in road traffic accident. Most commonly, common cause of death in road traffic accident is the blood loss, because their hemoglobin falls rapidly. But if the hemoglobin falls slowly, gradually over a period of months, few months, then the body gets adapted to it, and they may not feel symptoms. But yes, it for children it's very important, because for proper growth, hemoglobin is very important. If they don't have their normal hemoglobin in normal range, they will have growth retardation, and other problems, bone pain, bones become weak, like that. And for sorry, for adult patients where there is no problem of growth, so there actually the problematic thing is that because of low hemoglobin they feel weak, and their quality of life is not that good, so they will not be able to do heavy work. They will be uh, doing normal routine works, and ultimately if the hemoglobin falls further below, they will have difficulty in doing their normal work as well. And sometimes they can feel they can have pain in legs, pain in other parts of body, mainly it is the muscle ache. So myalgia and muscle ache, all these kinds of
Right.
symptoms are there.
So, Dr. Singh, what explains the high prevalence of anemia in our country? You said, the lack of nutrients, notably iron and, of course, folic acid. Shouldn't our diet, cover all of that? Why is it so prevalent in India? I mean, not many people
Yeah, so
have a diet very different in India than, say, other parts of the world. Or is it that our diets are like, are built in such a fashion that we don't get enough nutrients? What's the problem?
so uh, so yes, why this nutritional deficiency, why these factors are deficient in resource poor countries? So first thing is that the if we see the good source of iron, so what are the food items which have good iron content? So one is obviously the non-vegetarian diet, because especially the red meat, which is not our routine diet. So especially in India, if we see, and other thing is other food supplements, which other food items which have a good iron source is the cereals and green leafy vegetables. So, and cereals also, if you see like ragi, jowar, bajra, they are good source of iron, and green leafy vegetables otherwise. So sometimes, and other thing I want to mention is that sometimes in means uh, good affordable people also, because of their dietary habits, if you eat a lot processed food, then also they are deficient in iron, because the processed food like noodles and other things, which you most of the people call it as junk food. So actually if you see, it is actually junk food. It will not have those kind of nutrients. So this is about the iron. So good source of iron is non-vegetarian diet. Then other source is cereals, and the other third source is the green leafy vegetables. Then when we come to B12 and folate, so B12, again the B12 source is the good source is again non-vegetarian diet. So that has got good vitamin B12. Vegetarians not good option for both B12 and folate. Not very good source. Eggs are theirs. They have B12 plus. Normally, our intestinal flora they produces B12 and folate. So that's how vegetarian diet compensates for it. But yes, if their flora, if they have GI disturbances, then they can have deficiency of B12 and folate as well.
So, Dr. Singh, what is the way then to treat this problem? There is only as much as you can do to influence someone's diet. If I'm a vegetarian, you cannot force me to eat red meat.
Yeah.
If I cannot afford it, if I cannot afford dal, you can't say, no, no, you'll get anemia, you better buy and eat dal. In our country, how can you then overcome this problem? Is it going to be supplements? Is that the only way out?
Yeah, sometimes from government side also the food supplements. I don't know from government. Nobody has from government also there. Nobody has ever thought of supplementing iron in the cereals or in the diet, because if you remember, now we see iodine supplement in salt. Almost every salt comes with iodine, because iodine, and that really made difference, because because of iodine deficiency, a lot of goiter was there. So after supplementing iron in this iodine in salt, so that problem has almost overcome.
So,
And
Dr. Singh, you're
so
talking about fortification of food.
Yeah, so one thing is that fortification. When we are looking at mass, means when you are looking at whole population, fortification of food is the thing which can be done, like vitamin D supplementation in ghee and iodine supplementation in salt. But the problem with iron supplementation and B12 folate supplementation in food, it's actually not cost effective, and you cannot put iron in that because it has got its own means. How can you because it's the cereals and other things, and we have other good sources of that. So one thing is that green vegetables we can increase in our diet. Then cereals, if you see, like wheat, even wheat has got other bajra, which are not very costly, so like can that can be taken. So the other thing is the most important thing is that we have to recognize this problem. So when if you are feeling weak and this, it's better to get the hemoglobin checked. And then even if you take medicines also for B12, folate, or iron medication, they are also not very costly. Iron tablet cost you around just 25-50 paisa, one tablet.